Hi, I'm Kent Dana. It's a decision most families will eventually have to make. How to make the final days of a terminally ill spouse or loved one comfortable and comforting. And it's a decision that Randy Garza had to make, and for him the choice was clear.
There's options, there's things that you can look into and questions you can ask. So I did, I called Prime Care. They immediately sent someone over because I said, I'm signing with this other company at 10 this morning. So they met me at the hospital at about 7:30 that morning, and we went over different options. They were very complete with their answers. Where the other company was looking at taking her away from the home setting, and they were talking more about near death as opposed to end of life. And to me, there was a huge difference.
And our goal is to give the best patient care possible. We always err on the side of the patients. We keep our nurses and our social workers with low caseloads so they can take care of the patients and not be overloaded and having to run from one patient to the other. We have staff available 24 hours a day, and the families call on the weekends or on the evenings. We actually go out and visit those patients and the families to take care of their problems. We try and listen to them to see where they're coming from.
I can't even begin to tell you what a godsend it was for us because we just didn't know. Nancy with Prime Care came out that morning, and I was nervous because, your mom's going and you're not thinking right. You don't know which way to turn. And Nancy literally took my hand and said, take a breath. This is a course that everyone goes through, and we're going to help you get through it. And we also have chaplain care that comes and just gives me a boost. And my mom's a Christian woman, and so just the fact that he can pray with her just makes her day.
My staff, what they do a lot of extra things. They'll stop by and get them a hamburger if they want on the way, or the CNAs will curl their hair and put makeup on. And then sometimes we just sit and listen. Our volunteers, we have pet therapy, we have music therapy, and our volunteers just go and talk to them. They make them little blankets, they do life story review. They have this fantastic book where they fill in their life story as they get to know them, and they give that to the family. It is really, really special.
In the hospital setting, she had lost that little spark in her eyes. It was dwindling, but she would utter the words home, 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 home. That's all she wanted. So when the first company, that wasn't really even an option, gosh, you can imagine how that ripped at my heart, and knowing what her wishes were. So when Prime Care stepped in and said, well, of course, home is the best option. And when we were able to deliver that news to her, you could just see her little face light up. And now when the caregivers stop by and she gets to see them, she cracks a little smile, and she can't do much anymore, but she's pleased to see them, and she knows that there's people out there that care, and she just revels in it. It's a big difference.
For more information about Prime Care Hospice, call 623-847-2323 or visit their website at primecarehospice.com.